This does not include PACE, this does not include Med Solutions, but I think what this shows is that there have been a steady increase, significant growth, obviously, in connection with the use of the historical expenditures for the LME, MCO, and those payments. We saw in just 2014 alone that there was a significant growth. Now that $2.4 billion that has been paid, that represents about 23% of the overall spend as far as claim payments go. We expect to see continued growth in this area. One thing that we mentioned, and as it's referred to here, the 1915C, the waiver amendment, what that does, it provides home and community-based care to beneficiaries who would otherwise be institutionalized. Because of that, we expect to see more use of higher growth in these specific areas as far as institutions. So pharmacy services. This we took a little deeper dive. So what we have here for 2014, this represents about 13% again of total spend. There has been a considerable growth rate here. We have at 7.4% of those gross expenditures actually increased in 2014 by 12%. Now that was partially mitigated by the drug rebate growth. We have gone from $669 million approximately to $723 million in drug rebate recovery, so about 8.1%. So while the growth overall has been approximately 12%, it was partially mitigated as a result of the drug rebates. Brand drugs. Brand drugs have grown by 14% in 2014, again with a compounded annual growth rate of 6.6%. The generic drugs grew by 5.8% in 2014 with a compounded annual growth rate of 10.3% over that time period. So we've also seen a steady rise in specialty drug therapies in 2014, especially Sovaldi, which is the hepatitis C drug. Utilization of generic drugs increased by 14.3% between 2010 and 2013. Now, according to CMS, between 2015 and 2022, rising prices and increased utilization is expected to grow faster, and the overall projected growth is supposed to be 6.5%. It's something that we have to keep very aware of. And the other issue that I think is worth noting, while generics are clearly cheaper than the brand drugs, I think everybody understands that, but from a comparative pricing standpoint, it is starting to shrink because generic drug makers are starting to consolidate. So we have to be mindful of that going forward as those costs continue to grow. Now, one of the reasons why I think we have seen somewhat of a leveling off, at least in various services, as a result of the shared savings, which 3% rate cut that is effective 1/1/14. It'll be interesting to see what that full impact is going to be going forward. Skilled nursing facilities. This represents about 11% of the total claim spend. So although total spending has remained flat, we do see an increase in acuity. The case mix index component, which will start January 1st in 2015, will assist in controlling the future expenditures. But we are continuing to explore home and community-based alternative programs to further lower the overall spend. But overall, over this 4-year period, we've seen a decline of about 0.3% over that period. And in 2014 was a 1.2% increase. Lastly, in terms of the specific spend areas, we took a look at dental services. Now, dental services, their rate change have been frozen during the last 5 years. That has resulted, I think, in a reduction of your overall compounded annual growth rates. We have seen how those rates have come down. Based on just anecdotal discussions that we've been having with providers, there seems to be an increase in the demand for services in the northeastern part of the state and western counties. let's talk about the forecast and budget process and where we are. Some of the things that we've been doing, and we're in the process of changing the way we're doing the budgeting and forecasts. And I really want to emphasize particular areas. When you talk about what makes up your budgeting and forecast process, it really makes up, in my opinion, three specific pieces. It's the process, it's the methodology, and it's the application of what we call the tool. So as part of the process, and again, I go back to my insurance days and when I used to do budgeting and forecasting. It was never done in a vacuum, and I cannot overestimate the importance of that process. When I was involved with budgeting and forecasting, we involved our actuaries, we involved our claims people, we involved our underwriters. That process needs to change, and we are in the process of changing it currently within DMA. So we're getting much more involved in terms of who are the people that know the business the best, and those are the program people. We've been working with them day in and day out in terms of understanding what their spends are so they can get a better handle and understanding from what their spend is. But we're not relying on that process. We're also looking to use outside sources, whether that be SAS, working with OSBM, working with FRD, and working with others in trying to identify or improve the overall process. One of the other things that we're looking to do is we are definitely going to be building into our model is sensitivity analysis. I think it's stochastic modeling and identifying and running various forms of sensitivity analysis is going to be critical. The other area is version management. It sounds simplistic or it sounds that it's something basic, but believe it or not, it isn't. The version management protocols have been established so we can keep track of which versions that we have. So that always seems to be a problem. The other is, and I briefly touched upon it, we're collaborating with outside subject matter experts to help us with the enrollment projections. As I mentioned before, enrollment really just drives so much of what Medicaid process does. So again, we're working with SAS, we're looking to contract with them, working with OSBM from their state economists, working with FRD, as well as using outside resources such as CMS. So what's the next part that has to be done? I think Senator Heiss, you had mentioned upon this, and you're absolutely right. The next challenge that we have is to normalize 2014. We cannot start building a budget, we cannot do our forecasting until we normalize 2014. So when we have to take into consideration things like the backlog, when we have to take a look at items such as money bills and what that does on an annualized basis, we have to incorporate that so we can have a smooth 2014. Now, it hasn't been easy, I'll be honest with you, because you're going from one new system, which was HP, to NC Tracks. So I think Pam had mentioned to it, Joe Cooper has mentioned to it as well, alluded to it, is that the taxonomy is different. So one thing that we did is we had loaded in our 2011, 12, 13 data. Now we have forecasted off of that and tried to take a look at what 2014 would have been if that would have continued. And now we're in the process of doing a reconciliation between what that outcome shows versus what the actual detail shows. Then the methodology. We're taking a look at key expenditure drivers being identified through sessions with, again, the DMA program managers. We're in the process, but we're not relying on that. If again, going back to my insurance days, we relied just on what our underwriters would say, there would be significant differences in terms of forecasting and budgeting. So what we rely on is, and what we're doing more of a validation, is we're talking to having discussions with external parties, outside subject matter experts. Those findings, once we come to a conclusion, will be built into our model. We'll be making sure that that gets loaded. And also regarding methodology, the recipients and net expenditure, the monthly data have been loaded at the program aid category. So that's, again, what's going to be driving our overall model. I'm going to touch upon a minute the whole idea of the tool or the application. There's been much said regarding, well, is Excel the proper tool? I think it is. I think Excel is a very robust tool that you can use for a lot of analytical work. I think we took a look at it. We actually had discussions with a former budget officer. in when he was involved with the SAS and the opportunity of maybe putting that in. We have concerns regarding the SAS tool. We actually had meetings with SAS directly. We had asked them point blank as to what other states currently use SAS, and we understand that there are none. So that was the one constraint. The other part of it is, if you're going to get such a sophisticated tool and put that in place for purposes of DMA, you need to hire people that understand those tools. And at this point, we are not there yet. We are building the foundation. We are building the structure. We're putting that into place. So better forecasting, better budgeting can be done. And I don't want to de-emphasize here the importance of the process. Now, clearly, as seen by the deficits over the years, there have been a number of experts who have been involved with this process. Unless you have good assumptions, unless you identify what those assumptions are, unless you could stress test what those assumptions are, it becomes garbage in, garbage out. And so we are going to, we're working with outside constituents. I think the Excel model works fine. I know others, we have used it within our firm. I think Dr. Glenn had mentioned that we have used it in South Carolina, we use it in Pennsylvania, and we use it in Maryland as well. Lastly, the sample dashboards, that mock-up has also been created. The slide's a little tight here, but what I want to emphasize, one of the things that we looked at when we started, when I came on board, was take a look at an E&Y study that they did in 2013. And E&Y had identified various recommendations, observations, what they felt didn't exist in the formal model, and what they think need to get done. So again, let's talk about what I mentioned before: processes, methodologies, and the tool or the application. We have completed and have already have in place 7 of the 11 where we say, yes, we will have that done. We are building the other 4. The documentation and process methodology is in place. The multi-year forecast and the capability and the sensitivity analysis, the shell of that has been put in place. So we are building these as we speak, and we have a team that's been working and loading this information. Get back to what I mentioned before, the biggest challenge right now is just normalizing 2014. So as far as the methodology, where we have no there, in both the former and the current, what needs to be identified is really in the footnote there. We are using not necessarily SAS or some other tool to do the entire budget, but we are using it in terms of doing forecasting of enrollment. And then we're looking to triangulate that whole process, working with SAS, working with OSPM, and as well as working in conjunction with our program people. And I touched upon also regarding the tool. Do we have one single tool that we're going to be using that supports? No. Again, we're using SAS as it relates to forecasting enrollment, and we're going to be using Excel in terms of building the forecast and the budget. And then, again, we still have to build. We have a dashboard platform that's in place, and that information governance model is in place as well. So that concludes my presentation. If I have any questions, be happy to take.
Chairman Hayes.
Thank you, Mr. Chairman. I guess I'll kind of start in some of the looking back. I first want to say that probably the thing that gives me most concern is your concept about developing a forecast and budget model on the Excel operations that's kind of coming through. We're talking about a $20 billion budget, and you're talking about placing variances in your individual variables, and having worked with Excel, being certified in Excel, as well as a former programmer for other software systems. I will tell you that experiences from those like the U.S. Census Bureau and others will determine that you will reach a point that it will break. We may not be there yet in our budget and forecasting. I think some of these are an improvement of what we have now from what they're going through. But I think as we are taking this opportunity to develop a new system, the biggest question I would have on this is, as you develop a budget and forecasting model, I know you've worked in the insurance area and those kind of things, what type of reserve, what level of reserve Do you think it will be necessary, or do you suggest one, that it will be necessary for the state to maintain so that it's not continually coming back to a legislative process that every time it under forecasts and having to come back and revert all the funds back into the state every time it over forecasts? What do you think would be an appropriate level for us of total expenditure or state expenditures that we would need to maintain in the reserve?
I don't want to put a number on it. It's tough to put a number on it on a year-over-year basis. It all depends how, what the overall budget is. We did have a request for a $100 million reserve, if I remember correctly, for this year. I don't think you could, again, I don't think you could necessarily just put a number on what a reserve. I recommend, and I strongly recommend, that a reserve be considered in future years. I think we need to look at DMA as an insurance company. We're doing that in terms of what we're trying to do from an alignment standpoint, or reorganization standpoint. We're putting compliance people in, we're going to have a compliance area, we're going to have a strategy section. So as it relates